Okay, Brad, we're going to start talking about blood clots, mainly in the calf.
Sure.
We're first going to talk about the causes of blood clots.
Yep.
Then we'll show you how to prevent them.
You bet, Bob. Blood clots, you got to be careful.
Bob and Brad, the two most famous physical therapists on the internet.
Okay, Bob, we got a list of causes. We'll go through them one at a time. First one, if you're bedridden for any length of time, getting too little activity, and sitting too much. All this lack of movement can contribute and increase your risk. Next one.
Sitting on a plane, train, or automobile, or watching the movie plane, train, or automobile.
Yeah, so again, that sedentary time where
Right, absolutely.
obviously a 5-minute car ride isn't, but a longer time duration. Oh, my turn.
Your turn.
After an injury or surgery, and us as therapists are very aware of this. We work with a
Yeah,
lot
it's
of.
very common.
Yep.
If you take a medication that causes blood clotting, and your doctor needs to tell you whether that's the case or not.
Right. Yep. And they let us know as therapists if we need to know something. But they,
Right.
don't be afraid to ask your
We
doctor.
always keep an eye on it.
Exactly right. Being overweight or obese, another risk factor.
Right. Or one I have is being over 60, but they can occur at any age.
Sure. Yep. Just the older you get. I'm still under 60.
Yeah, you're good.
I got
You're
28
safe.
more
No,
days.
it can again happen to anybody.
All right. Some types of cancer or cancer treatment, again, you'll be made well aware of this to
Right.
be what to look for.
Smoking, I'm sorry, there's nothing good about smoking.
Exactly right, Bob. Heart failure, if your heart's not working well, again, circulation problem, it
Right.
increases the risk.
Inflammatory bowel disease, or if you have a personal history, like you've had one before,
Sure.
or family history.
Yeah. If it's genetic or.
Right.
Yeah. All right. And if, like we said, genetic,
Thanks.
if you have more than one blood clot, you should get tested.
Right.
So for testing, you go in, they do an ultrasound. It's a simple test. It's completely pain-free, and they'll know.
Okay, Brad and I are going to show you 3 exercises you can do in bed or in a chair.
Right.
Brad,
Oh, let's
take it
get
away.
started. Okay. Ankle pumps. Again, you can do this either position.
You can do it on a plane,
Yep.
on a train, or a car.
Yeah. Do 10 to 20 of them at a time. You don't do them consistently forever. Take a break every half hour or so. Make sure you do your ankle pumps just like we're doing here. Not too fast, not too slow. Just do them.
Smooth.
Number 2, the infamous butt squeezers. So again, lying down, boy, therapists done this a lot of times with patients. You squeeze your buttocks together and relax.
And you can do it seated too.
Yep, exactly. You can do it with your knees up, knees down if you're lying down, and just squeeze and relax. Just about at that cadence and relax. Do 10 of those is good. Every half hour is good.
I can do them in secret.
Yeah. Are you squeezing there,
Yep,
Bob?
I'm
Yeah. Next. The next one, simply knee to the chest, one leg at a time. Bring it up. You can grab here and give a gentle stretch. You don't have to get real aggressive. Do alternate would probably be better, but you can just do one leg at a time and do it like this. 10 of them on a side would be fine. Again, every half hour. As long as it's not painful. If you have any problems and that's uncomfortable, do the best you can. We don't want to irritate things.
So, Brad, we have just a few more things to go over. One, you will stay hydrated.
Right. Get plenty of fluid. We're
I know
talking
you-
about water, right?
Right. I know you don't want to drink on a plane as far as water.
Yeah, that's trips to the
Yeah,
bathroom.
right. Exactly. But it's really important that you do.
Right.
So, number 2, I want you to get an aisle seat. So if you have to go to the bathroom,
Yeah.
you can walk along the aisle to.
I had that. I was in the middle seat, and the guy next to me was a large person. And you just don't want to have to get that
Right.
person up to get over the top of them. And, it's like one of those scenes from Seinfeld.
Yeah. All right. And number 3 is compression socks.
Right. So here I have a compression socks. They are, you know, they're compressed. They should be tighter here and looser here, and they'll be like 15 millimeters of compression.
Or 30
Yep.
millimeters.
Yeah, they'll give you the numbers, but it should
Right.
be tighter around the foot and a little looser here. They should go at this level, and you know, they're comfortable. They should be comfortable, anyways. I've worn these, and they're nice. I got to make sure they're at the right level.
Tough to put on.
Yeah, they're not the funnest to put on, but if they do the job, it's well worth it. And with a little practice, you'll get used to it.
There we go. That stops us the blood clots, Brad.
Oh yeah, no more blood clots. All right.
They're gone.